So here are just some of the benefits of physiotherapy. We're going to start with the first one, which is pain. Typically the factor that drives the person into the clinic to get help. So there's going to be another video on acute and chronic pain, but here's a summarized version of it. When an individual is in pain, our objective is to down-regulate the pain, to control the pain so that we can actually do the following steps in rehab to get the person better. So things we can do to manage pain are movement, electrotherapies, manual therapies such as cupping, dry needling, soft tissue work, and so on. The second stage of rehab would be range of motion. Once we get the person's pain under control, our objective is to increase range of motion to the maximal capacity. So for example, in the shoulder, when an individual's pain settles down, we want them to achieve full range of motion so that they can return to doing the things that they love. So the third stage of rehab is strengthening. Once the patient's pain is under control and we have achieved maximal range of motion, we want to really focus on getting the person strong. Strength will typically start central, so meaning we work on spinal stability, things that are more stabilizing, and then we work our way out. Each person will have a customized strengthening program based on their capabilities and their type of injury. Once the program is designed, we do a mix of home exercises, but also exercises in the clinic to help maximize their outcomes. For patients who have had, for example, head injuries, concussions, or athletes who really want to improve endurance and certain amounts of coordination, we do a part of the program called coordination and balance. So we do techniques where you're doing single leg stands, we put you on uneven surfaces, eyes open, eyes closed. We vary the amount of treatment in order to improve the patient's coordination, their balance, and their ability to complete the tasks that they're looking to do. Injuries, yeah. One part of rehab that's actually separate from the other ones we've just mentioned is prevention of injuries. There's a very small percentage of patients who are actually coming into clinics to prevent an injury from happening. They usually come in once an injury has taken place to seek help. So prevention of injuries, or prehab as we call it, is a very important part of rehabilitation because it actually prevents you from having a long-term problem. So injury prevention will start with an examination, and we'll find areas that are vulnerable to injury based on the patient's work, based on the things that they love to do, the sports that they play, and we build a program based around that to get them strong and healthy again.